Welcome to obstructive sleep apnea, also known as OSA. As a reminder, you want to also complete the ATI module on wellness and self that addresses this topic. It will be helpful to you, I promise. Obstructive sleep apnea can create serious disorders if not detected and treated early on. Basically, with this disorder, the muscles in the back of the airway relax and occlude the airway, preventing the patient from breathing. The telltale sign that this is developing is very loud snoring, as air is attempting to pass through a constricted airway. Apnea is defined as arrest of breathing for 10 seconds or longer, and hypopnea defined as ventilating 50% or less of normal. The brain then wakes your patient up to take a breath, leading to inadequate sleep every single night. According to the Mayo Clinic, these periods of apnea, alternating with gasping, awake, can occur anywhere from 5 to 30 times each hour. The result is a patient who is holding on to a lot of carbon dioxide and not exchanging oxygen adequately. The sympathetic nervous system is then stimulated to try to find ways of getting more oxygen to the cells and expelling more carbon dioxide. Anytime that sympathetic nervous system is stimulated, cortisol is released and your blood sugar increases. Also, with these patients, if they don't have hard-to-treat hypertension already, they will. They become extremely fatigued throughout the day and can fall asleep on a dime, as they never get a restful night's sleep. That is okay if you're home in a chair watching TV, but they have been known to fall asleep driving, and that, of course, is very dangerous. There are several risk factors contributing to obstructive sleep apnea, with obesity being the primary one. Interesting enough, though, there are many with obstructive sleep apnea who are not considered obese. As you can see by the slide, obesity in this case includes those with a BMI greater than 28. Other risk factors include patients with a history of hypertension, smoking, chronic nasal congestion, asthma, and diabetics. Men are more likely than women to have obstructive sleep apnea, but once women reach menopause, their incidence also increases. Anyone who overuses alcohol or sedatives will have an increased incidence of obstructive sleep apnea, as the muscles in the back of the throat become extremely relaxed. Therefore, their airways are much more compromised. As I said on a previous slide, apnea in this case is defined as periods of apnea of at least 5 times per hour. But we know that this can occur far more frequently. There are several types of sleep apnea, but being that obstructive is the most common form, we will focus on that one. The significant other who sleeps with someone with sleep apnea define the snoring the best, and guess what? It keeps them up at night also, all night long. There is a loud snore followed by the period of apnea, then they wake themselves up and repeat the pattern. It sounds something like this. How'd you like that? Hypertension results as that sympathetic nervous system is stimulated, and over time, this wreaks havoc on not only the lungs but the heart as well. Ask a patient with obstructive sleep apnea how they slept, and they may say well, because in many cases they don't remember the uninterrupted sleep, but trust me, the significant other will. Carbon dioxide is a potent vasodilator, with more blood potentially going to the brain, which can increase intracranial pressure just a little bit. This can result in headaches, noted especially in the AM as the patient wakes up. The patient may also notice mood changes and an altered libido. In diagnosing obstructive sleep apnea, a good physical exam will be required prior to the actual diagnostic testing. Again, diagnosis begins with a thorough physical and history, and those telltale signs and symptoms will lead to further orders for diagnostic studies. A polysomnography will require you to go to a sleep study center and get hooked up to all kinds of equipment to monitor your heart, brainwave activities, and pulse oximeter, for example. While if after part of the night it is pretty obvious you have obstructive sleep apnea, they may stop the study and place you with a CPAP device to see if these periods of apnea begin to correct. Some patients may not have obstructive sleep apnea, but restless leg syndrome could be diagnosed at this time. There are ways now to have testing done from your home. If obstructive sleep apnea has to do with nasal obstructions, the patient may be referred to an ENT physician. There are some simple fixes prior to consideration of CPAP devices if diagnosed with a milder case of obstructive sleep apnea, such as weight loss, exercise, but certainly not right before bedtime, smoking cessation, decreasing the use of alcohol, especially later in the evening, and possibly use of nasal decongestants. Sedatives before bed should be avoided. There is a surgery available where the uvula is removed in an effort to try to open up that airway a bit more. It is also encouraged to sleep on either the side or the stomach and not on the back, as the tongue will have a better tendency to slide back down into that airway while you're laying on your back. Like it or not, ultimately the patient will have to begin to use some form of positive pressure. What this does is forces pressurized air into the alveoli constantly at the same pressures, which is CPAP, to keep the airways open, or different volumes can be set during inhalation and exhalation, which is BiPAP. Positive airway pressure improves sleep, decreases daytime sleepiness, improves concentration, and absolutely reduces the patient's blood pressure. Not for nothing, associated motor vehicle crashes due to obstructive sleep apnea would be reduced. There are a myriad of devices on the market today, but the idea behind each use is the same. Compliance is a major issue with use of these devices due to comfort and noise. There is much research ongoing to find the most comfortable apparatus possible, yet still achieve the goal. Whatever device is used, it must have a tight fit to maintain the pressurized air. Quality of life is so improved with positive airway pressure, so the patient is encouraged not to give up before they really give it a chance, and adjustments made as needed. Once they do get used to it, they won't go to sleep without it, I promise. If the airway dries out, there is the potential for adding humidification. Although medications are not preferred over positive pressure, there are several pharmaceuticals on the market today to assist those with obstructive sleep apnea. Modafinil is a stimulant which assists those patients with extreme fatigue to stay awake. It should be taken 1 hour before a work shift begins, so for most of us that's in the morning. Patients with compromised liver function and older adults should be taking a reduced dose. Taking a stimulant will produce those common side effects of dizziness, nervousness, insomnia, and headaches. Solriamfetol is a dopamine norepinephrine reuptake inhibitor. So essentially, the sympathetic nervous system is being stimulated and the patient will experience more wakefulness during the day. There are not the liver issues with this drug, but you must have good kidney function in order for it to be excreted properly. The side effects are essentially the same. On D2L, I have uploaded more information on these two drugs and others once used for your perusal, but you certainly don't have to memorize all that information. The biggest complication of obstructive sleep apnea is right-sided heart failure. With repeated episodes of hypoxia, vasoconstriction occurs in the pulmonary capillary beds, which makes it harder for the right ventricle to pump its volume through into the pulmonary arteries. Remember those signs of right-sided heart failure, which includes hepatomegaly, jugular venous distension, anorexia, and peripheral edema. As you can see by this diagram, ultimately, untreated hypertension affects not just the right side of the heart, but the left side as well, and all that follows. As for nursing interventions, I discussed many of these already. It is so important to incorporate extensive teaching, especially with a newly diagnosed obstructive sleep apnea patient. Many of these interventions are suggested for patients who generally have an issue with sleep. Direct any questions you may have to your instructors in class, and thank you.